Good afternoon, sir. Myself, Dr. Mahalakshmi. I am presenting a prospective cross-sectional study of ocular manifestations seen in patients with iron deficiency anemia. Coming to introduction, anemia is the most common hematological disorder presenting with a variety of ocular manifestations. As we know, iron deficiency is the most common nutritional deficiency in India. So, iron deficiency anemia is the most common anemia in India. Almost 30% of the world's population suffer from iron deficiency anemia, out of which more than 80 to 90% of the patients are seen in developing countries. Iron deficiency is defined when the level of hemoglobin is less than 13 gram per deciliter in male and less than 12 gram per deciliter in females. The aim of my study was to determine the prevalence of various ocular manifestations which were seen in patients with iron deficiency anemia. Materials and methods. This study was done on 85 patients. Informed consent was taken from all the patients and all the patients were subjected to routine hematological investigations. All the patients which were included in the study underwent a detailed ocular history, visual acuity, slit lamp examination for anterior segment manifestation and a dilated fundoscopy examination for posterior segment manifestations of anemia. Based on the level of hemoglobin, they were graded into 3 grades: mild, moderate and severe grades. Mild grade was considered when hemoglobin was 10 to 11 gram per deciliter, moderate when it was 7 to 10 gram per deciliter, and severe type of anemia when hemoglobin was less than 7 gram per deciliter. Inclusion criteria: all the males whose hemoglobin was less than 13 gram per deciliters and females with hemoglobin less than 12 gram per deciliter were included in the study, and patients with history of hypertension, diabetes mellitus, history of any ocular trauma or any systemic illness which might lead to posterior segment involvement were excluded from the study. Coming to result wise, gender wise distribution of the patients. In my study, the majority of the patients were females, accounting for 82.3% and 17.6% of the patients were males. Distribution based on the severity of the anemia, 66.6% of the patients were having mild grade of iron deficiency anemia, that is 57 patients were seen having mild iron deficiency out of 85 patients. And anterior segment manifestations include lid edema, conjunctival pallor and subconjunctival hemorrhage. None of my patients had lid edema and subconjunctival hemorrhage, and the most common manifestation was seen was conjunctival pallor, that is 77% of the patients. Next, coming to posterior segment manifestations of anemia, which ranged from variety of conditions like retinal hemorrhages, posterior port pallor, articular attenuation, cotton wool spots, hard exudates, rod spots, papilla edema and central retinal vein occlusion. The most common posterior segment manifestation in my study was retinal hemorrhages, which were seen in 18% of the patients, and second most common posterior segment manifestation was posterior pole pallor, which was seen in 11% of the patient, and rarely one patient had presented with central retinal vein occlusion. Discussion part. As we see, most common ocular manifestation, anterior segment manifestation was conjunctival pallor, which occurs due to constriction of small blood vessels in the conjunctiva. Similar studies were done by Pragati Garg et al. And Jitendra Kumar et al. They also showed that conjunctival pallor was seen in 100%, almost all of the patients, that is 100% of the patient and 83.3% of the patients. And retinal hemorrhages, which occurs due to hypoxia, there is substrate for retinal metabolism is reduced, so it will lead to increased permeability, reduced oxygenation and extravasation of the blood and blood products, due to which retinal hemorrhages are seen. Similar study was done by Sonal Mittal et al. They showed that the retinal hemorrhages were seen in 35.533% of the patients, whereas in my study it was seen only in 18% of the patients. Next, coming to conclusion, ocular abnormalities increases with the increasing the severity of the anemia. So all the patients with moderate to severe grade of anemia should undergo a routine complete ophthalmic evaluation. So therefore, fundus examination should be a part of essential routine examination in all cases of suspected as well as confirmed anemias.
This is a nice presentation. So what do you think that can we use AI in such cases, in anemia cases? Can we do some screening somewhere and get these patients screened out and be diagnosed? Can we do it?
Yes, no.
Is there any study on that?
similar studies were done by many studies are there, ma'am. Like they have screened a lot of patients where they have.
What places you can screen such cases? You have 70% females, so where would you like to screen them?
From rural tertiary care centers, rural places like.
Gynae OPT. Yeah. So I have a question that 18% had retinal hemorrhages, and that seems to be one of the most concluding part. But what you have not told us is that out of these 18%, how many were in mild, moderate and severe anemia? Because if there was retinal hemorrhages in a patient with mild anemia in the mild category, then that means there is something else there.
Yes, sir.
Right. And even the other one, I mean, you had CRVO and rod spots also over there. So again, you ideally basically need to categorize them, because conjunctival pallor is again a very subjective test. It's not something which is there. But yes, any positive finding. And also, what is posterior pole pallor?
The pinkish hue of the retina is pallor compared to normal.
Yeah, but what that means that they're getting they're
Is it
getting.
generalized or is it posterior pole?
Where do you get posterior pole pallor?
Vein occlusions, artery occlusions.
Yeah, artery occlusion, basically CRA. So basically, you need to categorize them first as to whatever positive findings you get, whether you gotten them in severe cases or whether they're actually, blood-related retinopathies or not. That is one important thing.
Other
which I'm very
hypoxic
glad.
states also.
Yeah,
Can have.
yeah,
Quantifiable.
yeah. It should be quantifiable to a certain
Just
extent.
like saying pallor of the posterior pole, I don't think signifies anything.
Yeah,
You can say this is pallor of the posterior pole, I would say this is no.
but there is no, and this pallor has a grading. I don't think that pallor of posterior pole has any grading.
Never been described also.
Yeah,
We have not.
yeah. Thank you.
Thank you.
Thank you.
Good. Your presentation is very good, but there is scope for improvement.